If you're watching this video, it means you already had surgery. I hope things are going well. I hope you're pleasantly surprised that it's better than you thought. And if you need anything, I want you to reach out to us. You're gonna text me, you're gonna call the office, you're gonna let us know if you think anything is not right. In this video, I just wanna go over some of the things that this shouldn't really be new information, but I want to just, now that all that other stuff is behind us, we can now focus on just these things and not the other stuff. So it's a little bit more targeted to what does life look like for the next week, and then until we see you in 2 weeks, and then what happens throughout the rest of your healing. We had given you a lot of different medications, and I will say that because this video is gonna be for many different people, some of the stuff I might talk about right now might not apply to you. So be patient with me there. And if there's any questions after this that you still have, text me, call the office, let us know, okay? But when it comes to the medications, there's the antibiotic. You would have started that before surgery. You're gonna take another one the night of surgery, and then after that, for the next week, you're gonna take 3 of those pills every day, spread out throughout the day. So it's gonna be like, take one when you're up in the morning, middle of the day, and then before you go to bed at the end of the day. And you just do that until they're gone. Like always, until they're gone. Don't stop in the middle, just take it till it's gone, okay? That one's an easy one. The steroid, if it was a bigger surgery, or if it's a surgery smaller, but we did a lot of grafting, we often are gonna give you a steroid. The steroid it's called a Medrol dose pack. Sometimes you don't see that on the package. It says methylprednisolone. That is there to help with swelling. And if you had sedation, then you're gonna start that the day after surgery. The morning after surgery, you're gonna start that. And on day 1, you take 6 of them. On day 2, it's 5, and then 4, 3, until it just tapers off. But you don't take them all at once. It'll tell you if you open the box and you pull out the card that has all the pills on it, and you look at the back in small writing, it will tell you that, for example, day 1, it's take 2 at breakfast, 1 at lunch, 1 at dinner, and then 2 at bedtime. And then the next day, it'll tell you when to take only 5, and then 4, and then 3. And so just follow those instructions. And if you have any questions, let us know. Pain management is the one that usually goes pretty smooth, but occasionally brings up the most questions for people. Our go-to is just use ibuprofen and Tylenol. The ibuprofen I'm talking about is what we would have prescribed. It's a bigger pill, it's 800 milligrams. Because it's a bigger pill, it takes a little longer for your body to break it completely down, which means kind of more like a longer lasting effect, but then using it with Tylenol. Now you can take them at the same time because they work on your body in different ways that they don't compete. But what I recommend, just so you're always kind of giving yourself a little extra something for pain, is to stagger it. What that means is if I've given you a bunch of these 800 milligram ibuprofen and your limit for the day is 3,200, that's 4 of those pills. And if you spread it out throughout the day, that's almost taking 1 of those pills every 6 hours. And so rather than going 6 hours before giving your body something else to manage the pain, lean on Tylenol. I recommend just getting an extra strength, like a bottle of extra strength Tylenol. And then, so now if you took your ibuprofen at say 7 o'clock in the morning when you got up, at 10 o'clock, 3 hours later, that's when you're gonna take an extra strength Tylenol. Probably you could just take 1, depending on how you're feeling. If you're feeling the need, you could take 2. Just know with Tylenol, your daily limit is 3,000, which is 6 of those extra strength Tylenol. That's what I think should be your go-to. And if you do it that way, it's gonna manage a lot of potential pain. But if there's any part of that just isn't working for you, that's why we gave you a few. Usually we just give out 3, but we give you a few of the tramadol. Tramadol, and we give our tramadol mixed with Tylenol. So it's got the tramadol, but it also has like 325 milligrams of Tylenol mixed together in something called Ultraset. And so if you take a tramadol, just know that you gotta make sure you're paying attention to how much Tylenol did you take, and that has Tylenol in it. That is meant for if it's not enough, or what a lot of people do is they will take a tramadol the night, like before going to bed, just to have something a little stronger, because tramadol's stronger. It's a synthetic opioid, and it's a little bit stronger. So you take that before you go to bed at night, just to give a little extra so you can get a good night's sleep. If we had given you something even stronger, like a true opioid, like a hydrocodone, oxycodone, we always prescribe those, at least our go-to, is to be mixed also with Tylenol. Same amount, 325 milligrams. If you combine hydrocodone with Tylenol, they call it Vicodin, at least the one that we usually prescribe. And then if you do the same, where it's oxycodone with Tylenol, it's called Percocet. So we may have given those to you, and we see those as like the thing to turn to if the ibuprofen and Tylenol stagger is not enough for you. Let's say whatever we gave you for pain management is not doing it for you. Let us know. There are other options. There's almost always something we can try different if you feel you need something more. Because most people don't, we don't just give it, but we're happy to give it if you need it. So stay in contact, keep us in the loop. All right, so that's the medications. The other two things I wanted to hit home with you now that surgery's done is, and these are two very important things, and it's things that you have control over, and I'm gonna try to convince you to be very diligent with this. One of them is diet, and one of them is hygiene. The reason diet is big is that in the very first week, our goal is that your gums are able to grow back together, which means anything that's gonna cause that to be disrupted is going to potentially cause sutures to come out too early and maybe even cause an incision to open up. Now, we'll be able to address it if it does. It's a much nicer experience for you if those incisions stay together. So for the first week, we promote a non-chewing diet. So that means if you can drink it or you can put it in your mouth with a spoon and immediately swallow it, that is what's in your best interest. And so amidst that, the thing that I can't emphasize more is the need to get a lot of protein in your diet, because some of the foods that you're gonna drink or you're gonna eat with a spoon are not high in protein, but if you don't get enough protein in your diet, you're gonna feel pretty bad after a few days. So protein, protein, protein. So a protein drink is like the perfect thing for you to use during that first week to be able to have what your body needs, but also in a way that's not gonna get down and disrupt any of the healing that's trying to happen. Some other things about diet you wanna pay attention to is you don't want anything that's hot. If it's warm, that's fine, but you don't want anything hot, because you don't want the hot disrupting blood clots that are trying to form, cells that are trying to grow across the gap. Just stay away from hot, and also please stay away from carbonated. So no carbonated drinks, no hot drinks for that first week. And so if you can just stick to that for the first week, you're already gonna have a better chance of a smooth healing process. So after you've gone for that first week and you're ready for foods that require some chewing, I just wanted to remind you that you are on what we call a soft food diet. We may have described it as if you can easily cut through it with a plastic fork, then it's soft enough to eat. That's the idea. And this is your diet until whenever the day comes that you are into a permanent material, meaning the zirconia teeth. If you're not in zirconia teeth, you're gonna wanna stick to a soft food diet, because even down the road, when your bone has fused to the implants and we're not worried about those anymore, we're always gonna be worried that if you have plastic teeth in your mouth, they will break if you're not careful with how hard you're squeezing through foods with them. So soft food diet, in the beginning, I would say softer food diet is wise, where you literally are sticking to things that are more like mashed potatoes and pasta, and like if you want meats like fish, ground meat, things like that. Anything that just really requires hardly any pressure to cut through it, stick to those things. Down the road, when the implants have fused or when the bones fused to the implants, but you're still on a soft food diet because maybe you're waiting a little bit until you get into zirconia, you can ask me in person and I can go into it more with you, but we can get through some foods that are a little bit harder than that. The thing I always tell people is there's a spectrum of hardness. And some of the stuff that's an example of just bad, don't try this or you will break your teeth is like a raw carrot. Just think of what it takes to bite through a raw carrot. You want to stay away from that kind of pressure. Beef jerky, anything that chewing it causes your muscles to get tired after you've been eating it for a little bit, those are things that you have to avoid because they are way too hard and you're gonna break something. The last category is hygiene. Hygiene is such a big part of a good healing process. But during the first week, it sounds a little bit counterintuitive, but I don't really want you to touch anything during the first week. Most of the time we give people a Stella Life product. It's a rinse, spray, and gel, and it's probably what you have. And with that product, the rinse and the spray, it's easy to apply without pulling on anything. But when it comes to the gel, that's the one that people always ask, do I still put the gel in? I say, yes, just be gentle with it. And sometimes I say, just put it on the teeth. You're not gonna hurt the teeth, but just put it on the teeth and let it kind of migrate to wherever it wants to go. And that should be enough. But during that first week, the goal is don't touch anything. Don't move things around. From week 1 until week 3, that's what we gave you that soft toothbrush for. And I'm talking the toothbrush, it's got a red handle to it. And the red handled toothbrush, the bristles on it, they are the softest thing you've ever seen. And the goal of that is not to brush the teeth part, like the part you can see. It's to target where the teeth and the gums come together. That little area where the two come together, you're going to brush that with this brush. You're still gonna do it with a very light touch and little circular movements. And by doing that, you're gonna help knock off some plaque that might wanna accumulate and just keep the area pretty clean. But you don't wanna be so aggressive that you're causing your sutures to come out sooner than they need to be or putting excessive pressure on your gums, just very, very light pressure. Now in the middle of that, so at week 2 is when you come and you see us again. We're gonna take a look, make sure everything looks good. We'll advise you on some things, but at that visit, we give you your next set of toothbrushes, and it comes in a nice kit, a company called Tepe. And with that product, I mean, it's a full-blown kit, but we'll go over the brushes with you, or one of the assistants will get out a model and they'll show you, this brush goes here, this brush goes here. That is our recommendation from week 3 until forever. Like these are brushes that are specifically made to clean around what we made for you. And because of that, you can clean most effectively with that. At week 3, you will also introduce the water pick. So up until week 3, don't get in there yet with the water pick. It's too aggressive. But after week 3, when the gums have completely come back together, then the water pick goes first, followed by the brushes. We have another video that dives deeper into these where I even show you the same things you're gonna hear from the assistants. This is where you brush with this one, this is where you brush it. There's gonna be a link to that video. If that's something you wanna watch right now, go watch it. But that is gonna be what hygiene looks like in your new teeth. I hope that these instructions have given you not just an idea on what that first week after surgery looks like, but it also helps you understand what the diet and the hygiene looks like for the weeks after that. If you have any questions, we're always here for you. You should have my cell phone, call the office, text me, let us know if you have any questions. Otherwise, sometimes with these things, it's just about giving it time.